once again, D is for danger, making sure it's safe to approach the area. I'm then going to try and get a response. R is for response. Baby Annie, baby Annie, baby Annie, baby Annie. No response from baby Annie. So that's when you're going to have a little look at the airway. Just lift that chin, make sure the airway is open, and then come down nice and close to listen and feel for breathing for a count of 5. 1, 2, 3, 4, 5. At that point, I knew that baby Annie wasn't breathing because I couldn't feel or hear any breaths or see any change in the chest. So I immediately started to give the 5 initial rescue breaths. You are breathing for your baby. You're delivering oxygen to your baby. What we need to do is get a seal over the mouth and the nose with our mouth. So you're creating a seal with your lips around the mouth and the nose. You're going to deliver 5 rescue breaths. Each one should be about a second long, and you're just going to take a normal breath for yourself. You don't want to take a big and blow too hard. It's just a normal breath. So that's 5 initial rescue breaths. You're then immediately going to go on to the chest compressions. To help you find the right place to be doing the chest compressions, you want to be drawing an imaginary line between your baby's nipples and placing your fingers just below that line in the center of your baby's chest. When you are performing the chest compressions, it needs to be a depth of at least 1/3 of the baby's chest. So it's quite a firm compression. You can't be doing a light push. You need to be doing firm compressions, depressing the chest by 1/3 and also allowing for the chest to relax in between each compression. So try not to bounce off the baby's chest. We want your fingers to stay in contact with the chest, but it is important to be allowing for that chest to relax as well. So the initial 5 rescue breaths only happen once. You never go back to 5. After the initial 5 breaths, you will then do your 30 chest compressions, 2 breaths. 30 chest compressions, 2 breaths. Now, at this point, if you have had somebody with you at the time you realise your baby is not breathing or not responsive, they would be phoning an ambulance. If you are on your own, the advice is to do 2 cycles of the resuscitation. So that would be 5 initial breaths, 30 compressions, 2 breaths, 30 compressions, 2 breaths, before picking your baby up into the recovery position and then going to find your phone. As soon as you find your phone, you're going to put your baby down on the nearest flat, hard surface, and you're going to call 999, put them on speaker, and continue your resuscitation. So you're not going to go back to the 5, you would just do 2 breaths, 30 compressions, 2 breaths, 30 compressions. Speaking to the ambulance while you're doing your compressions to give your address so they can dispatch the ambulance as quickly as possible. You're never going to stop this process. You're just going to keep going with 30 compressions and 2 breaths until the ambulance arrives. If there are 2 of you, you can swap the roles so that you could, because you will get tired when you're doing the chest compressions. It's quite a lot of pressure that you need to give when you're doing the compressions, and you will find that you get tired. But if you're on your own, obviously you're going to just keep going. The ambulance operator is going to stay on the line and talk to you throughout the whole process to support you and update you with how long it will be before the ambulance will be there. I'm going to go through the demonstration in real time so you can see it all brought together. D again is for danger, making sure it's safe to approach. Baby Annie, baby Annie, baby Annie, baby Annie, baby Annie. 1, 2, 3, 4, 5. Okay, she's not breathing. Okay. 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It's normal for parents, particularly with their own children, to be very apprehensive about chest compressions, and we know that it's common to just not go hard enough or deep enough. So if you're concerned about that and you think you're going too firm, you're never going too firm, so just go for it. Another question that we get asked a lot about is, am I going to hurt my baby? It is normal with resuscitations to break ribs. It happens in hospitals all the time. A broken rib is not a big deal. If you've successfully resuscitated your baby, their rib will heal. Babies heal very, very quickly. So it's much more important that you're not worrying about that and you're delivering effective chest compressions, and they require a lot of effort. As long as your fingers are in the correct place, you won't cause any other harm to your baby. I like to think about the visual of a beating heart, like we've usually all seen that visual of a heart beating, and it's a lot of force. It's really strong and it's really, really quick, and that's what we're trying to achieve externally. So that's why the compressions have to be rapid and they have to be deep. So I'm going to show you them one last time. I just wanted to talk a little bit about when is the appropriate time to call for help, because intuitively, when we discover that our baby is in this condition, we want to be calling for help immediately. If you live in a block of flats and you know someone might hear you, I think it's always good to shout for help. If you're in your home and you know that no one's going to hear you, the advice is still that to do 2 rounds of resuscitation before you call for help. The reason we say that is because you might not know where your telephone is. It might be upstairs, in the bathroom, in your bed somewhere, and we don't want you to waste time looking for it. We want you to do 2 rounds of resuscitation and then pick your baby up and go and look for your phone with your baby. As soon as you find your phone, you're going to be putting your baby down on the nearest firm, flat surface, calling 999 and having them on speaker, but getting straight back on with the resuscitation. Now, if your phone happens to be in your pocket when you're assessing your baby and you realise that they are unresponsive and not breathing, I think it's fine to grab your phone, call 999 and get them on speaker and start immediately the resuscitation. But we just don't want that big delay. This might be a time when you think about getting a landline and getting a phone where you always know where it is, it's in its cradle, it's charged, and there's not going to be an issue of trying to find your phone or finding that you don't have any battery power in your phone. One of the most common questions that we get from parents is, why will my baby be in this condition? So it's a little bit different with infants than it is with adults. With adults, it's generally cardiac problems, so problems with our heart. With infants, we would know if they had any cardiac issues from scans or from checks that we do around their birth. So most of you will know that your babies have a healthy heart, and therefore it's not a cardiac problem. So the main cause of collapse with a baby is respiratory rather than cardiac, which means breathing. So that can either be caused because of choking, which we're going to go on to in a minute, or it might be that there's some infection, so sepsis has taken hold of your baby and caused them to stop breathing. So what your job is to deliver the oxygen to your baby with the breaths, And then with your chest compressions, you're pumping that oxygen around to the vital organs, keeping them safe until the ambulance arrives to take over. They will be able to deliver IV antibiotics and IV fluids, which will be able to reverse the infection and make your baby better. The other thing to think about is access. So if you've got your own front door, this isn't so much of an issue. But for those of you in blocks of flats, the ambulance service will normally be able to override the door locking systems to enter the building, but you don't want to be sitting there in a situation where your baby is unwell and worrying about that. So a conversation that you can have with the concierge or whoever is in charge of your building, so you know that system. We never want you leaving the babies to run down and open doors. We want you to stay with the baby and wait for the ambulance to get to you.